Governor Jared Polis has made some big changes to try to get coronavirus cases down in Colorado again, and many of you have questions about the rise of cases in our state. That's why every week we get your coronavirus questions answered during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, last week Governor Polis issued an order that requires bars and restaurants to stop serving alcohol after 10 p.m. What does an earlier last call have to do with coronavirus?
Well, the hope here is that if you wind up lessening the number of hours that people have access to alcohol in a commercial establishment, they'll drink less. And if they wind up drinking less, they'll have a little bit more control and be more likely to follow the behaviors that we like to see in order to prevent the spread of coronavirus. The problem, though, is this is kind of narrow because it really does limit it to just a certain type of situation. It does not really take a look at people who are drinking at private parties, people who are having picnics, people who are having get-togethers. It didn't really have much of an effect on the concert and rodeo that took place up at Weld County over the course of the weekend, where evidently there were more than a couple of thousand people, a lot of young people, and there was a lot of alcohol flowing. And really the idea here, the target for this message really is younger people, because they're the ones who really are driving the spread at this point in time with much of the uptick in coronavirus, particularly in other states. And so what you're really trying to do is get a little bit better behavior, a little bit more encouragement of personal responsibility here with some of these public health mandates and guidance, so that we don't wind up becoming someplace like Arizona, where things are really kind of continuing to spiral out of control.
A CDC survey found 1 in 3 non-hospitalized coronavirus patients have chronic symptoms. Could people who get the virus have those lifelong problems?
You know, this is one of several reports that have kind of made their way to the surface over the past couple of months. And the longer that we have had COVID in the community, the more reports we're getting. And it's a disturbing type of report from the standpoint of we're finding that about 1 in 3 people who have had coronavirus don't fully recover. For things like a typical coronavirus patient, it's about 2 weeks from start to finish if they have symptoms at all. But we're finding that 1 in 3 have ongoing chronic symptoms, things like headache, fever, weakness, a shortness of breath, nerve problems, digestive problems, temperature spikes, and we just don't know what's going on with this. Now, here's what's disturbing about this. When you look at this 1 in 3 folks, the things they have in common is they tend to be folks who were not hospitalized. They were not ill enough to be hospitalized. Also, the age group that we're seeing this in is most commonly 18 to 35. So it's a younger population. So there's where that emphasis on younger folks and responsibility comes in. And then you take a look at the fact that these folks generally had no underlying medical conditions. They were fit and healthy. You do COVID testing on them repeatedly, and the tests keep on coming back negative, but yet they're just basically incapacitated, even though they initially became ill 2 months ago. So what we're really concerned is that COVID maybe isn't only an acute illness, but maybe something that is chronic, and even worse, maybe even a lifelong problem. These are worrisome things that we're thinking about right now.
And many districts have announced their back-to-school plans. Some are delaying the start of school. Many are letting parents choose if they want their kids to come to class or continue virtual learning. What do we know about how children transmit COVID-19?
I think that's one of the problems is we just don't know as much as we would like to know. We do know that kids tend to get coronavirus at a much lower rate than adults do, maybe 2% of confirmed cases in the United States have been in children. But the thing we don't know And this is even more important as you think about reopening school. The number of kids who don't have symptoms but yet are carrying the virus. And what's the deal with transmission of the virus? Well, we do know with some late reports here that up to age 10, transmission of the virus without symptoms is very unusual. However, once you hit that junior high and high school age group, things tend to change. They can spread the virus even though they have no symptoms to others. And so what you're looking at is you're looking at this circle where you perhaps have somebody come into school who has no symptoms. They wind up bringing it into a classroom setting. That puts other students at risk. That puts staff, teachers, and others at risk. And then those folks wind up bringing it home to others. It is a big concern. And so when you hear about just reopening the schools, you can't just snap your fingers and say, here we go. When you look at other countries that have successfully opened up their school systems, they have done three things in common. They have had mask use. They have made sure that there has been satisfactory distancing between students, whether in the classroom or out. And they've also limited any in-classroom teaching when the area becomes a local hotspot. So what does this mean for you as a parent? I think right now the local school districts are doing a good job. And a good job from the standpoint is they're trying to be fluid, preparing for the unknown. And so in this particular situation, we don't know what's ahead. And so you're going to be looking at a hybrid model. You're going to be looking at flexibility, and you're going to need to feel comfortable when we get closer to the start of school that it is going to be a different type of school year, and things will be ever changing and ever adjusting to the conditions here in Colorado.
All right, Dr. Dave, thank you as always for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just head to cbsdenver.com. We'll be right back.